I think that a lot of our patients with HIV, they face a lot of barriers. There are a lot of issues and a lot of reasons why they might not get the optimal care. I think it's important that we think about how can we be creative and innovative and how can we deliver better care to them. So I think there are just a lot of different issues, a lot of different layers, human factors and system level factors, and what we're trying to do is get to the bottom of those so we can just get people better care. There are a lot of studies looking at how much insurance helps patients, and that insurance increases access to care, increases access to medications. And so our study is another study that shows that sustained access to care is beneficial for patient outcomes. When this big national healthcare policy change of the Affordable Care Act came to be, we thought this would be a great opportunity to study and make sure that our patients get the same or better outcomes. So I think the most significant part of our study is that shifting from direct provision of medications in Virginia to Affordable Care Act insurance plans resulted in higher virologic suppression. Virologic suppression really is the most important outcome in HIV medicine. It's great for the individual because they live longer, and it's really important for public health because it means that we're avoiding more transmissions of HIV. We wanted to ensure that the association that we found was not a transient effect, so we continued the study for the second year of the ACA. We again found that ACA insurance plans were associated with higher rates of viral suppression for low-income people living with HIV in Virginia. We also built upon the work by examining the issue from different perspectives, including the HIV medical provider perspective and the viewpoint of people living with HIV. We performed a national survey to understand what HIV medical providers know and think about the ACA. We found some gaps in knowledge about the ACA, and our results demonstrated that HIV case managers and social workers are an important in-clinic resource for providers to learn and retain correct knowledge about the ACA. Additionally, we performed in-depth interviews with people living with HIV who transitioned from getting medications from the state to having an ACA insurance plan. The goal of this project was to better understand the patient experience and any barriers that they faced in getting enrolled. Privacy emerged as the biggest concern when transitioning to an ACA insurance plan, and there are lessons that we learned from this study that can be applied to designing and optimizing insurance benefits. Another health policy shift is on the horizon for Virginians and for people living with HIV in Virginia. As Virginia plans to expand Medicaid in January, we are preparing to study the impact of this change on people living with HIV. One of the best parts about this research is that it's a team effort between the University of Virginia and the Virginia Department of Health. The UVA team is truly interdisciplinary and cross-grounds. The group working on this project at UVA includes people from the School of Medicine, the School of Nursing, Public Health Sciences, and the Batten School of Leadership and Public Policy. Our goal is to help understand what health policies maximize health and well-being, and our aim is for our work to inform evidence-based health policy. We thank the UVA Translational Health Research Institute of Virginia and the National Institute of Allergy and Infectious Diseases for their generous support of this work.